for Health and Social Care to make a statement.
Thank you very much, Mr. Deputy Speaker. And with permission, I'd like to make a statement around coronavirus. Thanks to one of the greatest national efforts in peacetime, this deadly virus continues to diminish. Yesterday's figures show 530 new cases, down 90% since the peak. 162 patients are currently in mechanical ventilator beds with coronavirus, down around 95% since the peak. The latest number of deaths recorded in all settings across the UK is 11, the lowest figure since the 13th of March. And according to today's ONS data, for the third consecutive week, total deaths are lower than normal for this time of year. Due to this substantial progress, we've been able to restore freedoms and carefully and methodically restore the fabric of this country. However, we cannot let our progress today lead to complacency tomorrow, and so we must remain vigilant to keep this virus under control. Our strategy is to protect the NHS, get the virus down, and keep the virus down while restoring as much of normal life as possible. And our tactic is to replace national lockdown with ever more targeted local action as we work hard to defeat this virus once and for all. Our NHS test and trace system gets stronger all the time, and since launch 6 weeks ago, 144,000 people have now been asked to self-isolate who otherwise simply wouldn't have known that they had to. Where we find clusters or outbreaks, we take local action, tackling over 100 incidents a week. Mostly these are small, in an individual care home or pub or factory, but we're also prepared to take action on a wider basis if that's what it takes, just as we did in Leicester. 4 permanent test sites and 10 mobile testing units have been deployed across the city, meaning that Leicester now has the highest rate of testing in the country. We've launched one of the biggest communication programs that Leicester has ever seen, including targeted social media posts, website banners, radio ads, billboards, and even bin stickers. And we've been working closely with all parts of the local community, including community leaders, local businesses, and the local football and cricket clubs to get the message out. We've also established a process for making decisions to lift the lockdown, with the first decision point later this week. Mr. Deputy Speaker, local action is one way in which we can control the spread of the virus while minimising the economic and social costs. Another is to minimise the risk as we return more to normality. In recent weeks, we've reopened retail and footfall is rising. We want to give people more confidence to shop safely and enhance protections for those who work in shops. Both of these can be done by the use of face coverings. Sadly, sales assistants, cashiers and security guards have suffered disproportionately in this crisis. The death rate of sales and retail assistants is 75% higher amongst men and 60% higher amongst women than in the general population. So as we restore shopping, so we must keep our shopkeepers safe. There's also evidence that face coverings increase confidence in people to shop. The British Retail Consortium has said that together with other social distancing measures, face coverings can make shoppers feel even more confident about returning to the high street. And the chair of the Federation of Small Businesses has said that small firms know that mandatory face coverings have a part to play, and I quote, in the nation's recovery, both physically and financially, and that he is sure this will be welcomed. We've therefore come to the decision that face coverings should be mandatory in shops and supermarkets. Last month, we made face coverings mandatory on public transport and in NHS settings. This has been successful in giving people more confidence to go on public transport and to a hospital setting when they need to, providing people with additional protection when they're not able to keep 2 meters from others, particularly people they do not normally come into contact with. Under the new rules, people who do not wear a face covering will face a fine of up to £100 in line with the sanction on public transport. And just as with public transport, children under 11 and those with certain disabilities will be exempt. The liability for wearing a face covering lies with the individual. Should an individual without an exemption refuse to wear a face covering, a shop can refuse them entry and can call the police if people refuse to comply. The police have formal enforcement powers and can issue a fine. This is in line with how shops would normally manage their customers. And enforcement is, of course, a last resort, and we fully expect the public to comply with these rules as they've done throughout the pandemic. I want to give this message to everyone who has been making vital changes to their daily lives for the greater good. Wearing a face covering does not mean that we can ignore the other measures that have been so important in slowing the spread of this virus. Washing your hands, following the rules on social distancing. And just as the British people have acted so selflessly throughout this pandemic, I have no doubt they will rise to this once more. Mr. Deputy Speaker, as a nation, we've made huge strides in getting this virus, which has brought grief to so many, under control. We are not out of the woods yet, so let us all do our utmost to keep this virus cornered and enjoy summer safely. And I commend this statement to the House.
Jonathan Ashworth.
Grateful, Mr. Deputy Speaker, and I thank the right honourable gentleman for his statement. After days of ministerial muddle, we finally have a decision. I've long warned that this virus exploits ambiguity and that mixed messaging in a pandemic is so damaging. On Friday, we had the Prime Minister saying he favoured face masks. On Sunday, we had the Chancellor of the Duchy of Lancaster saying he didn't favour face masks. Yesterday, the Justice Secretary, unsure what to say, had to say in the end he was perhaps in favour of face masks. It didn't have to be this way. We didn't have to have this confusion. We've long known about airborne transmission via aerosols. He's long warned about asymptomatic transmission. The Royal Society, the World Health Organization, has long recommended wearing face masks. Even Donald Trump now wears a face mask, although admittedly it's because someone told him he looks like the Lone Ranger, Mr. Deputy Speaker. The chair of the Health Select Committee, his predecessor, has long warned about wearing a face mask, and his own advice, published on the 11th of May, advised in favour of wearing face masks. So why has it taken 2 months for him to make this advice mandatory? And why will it take another 11 days for the measure to come in? The World Health Organization has said throughout this pandemic, act with speed, but yet again, this government appears to be in the slow lane. All we need and want is clarity. So can we also have clarity in other areas? What now is the position on workers returning to offices? Does the government want them to return to offices, yes or no? And can he offer greater clarity to the people of Leicester, now in the 17th week of lockdown in my city? Can he tell us what metrics will be used to judge whether Leicester can ease out of lockdown later this week? When will he make that decision? And how will he communicate that decision to the people of Leicester? And can he clarify why the Business Minister, the Honourable Member for Stratford, has ruled out extra support for Leicester businesses and employers, contradicting the indications that he gave to the people of Leicester? When people are worried about their jobs, this mixed messaging is the last thing they need. And of the other areas that have been identified for concern, the other parts of the country, will he instruct the Health and Safety Executive to inspect all factories, all meatpacking plants, all distribution centres and all large employment sites as a matter of urgency? On testing, local authorities still need specific data that can facilitate action. They still need, he disagrees, they still need person identifiable data, not just postcodes. They need not just positive test results, but they need the negative results as well, so they can understand the overall infection prevalence. And they need contact tracing data, so they know who has been asked to isolate by test and trace, so they can follow them up. And they need it daily. The virus doesn't wait a week, so why should local directors of public health have to wait a week? I notice in the financial statement that 10 billion has been allocated to test and trace. Can he itemise what that 10 billion has been spent on? And can he rule out spending more on private outsourced companies and invest more in NHS labs and testing instead? Finally, Mr. Deputy Speaker, today we have a report from the Academy of Medical Sciences warning of a new wave of infection this winter. SAGE has also warned that the transmission of the virus, quote, could be elevated under UK winter conditions. Yet missing from last week's financial statement was any increase in NHS England's revenue budget. Instead, we have a mooted NHS reorganisation, with suggestions that Public Health England could be abolished, speculation that a new Centre for Disease Control set up in its place instead. But NHS staff need certainty now more than ever. So will he ensure the NHS and the social care sector gets the winter funding it needs to prepare for a second wave? People want to do the right thing. Muddled messaging hinders that. As George Osborne said yesterday, people just want answers. Can he give our constituents answers today?
Well, Mr. Deputy Speaker, I can certainly answer some of the genuine questions that were under there. But just beforehand, I think the tone of constructive engagement that the honourable gentleman used to engage with was a better one for him. After all, on this point of face coverings, we clearly follow the evidence on face coverings, and I set out some of the reasons why now is the right moment to introduce this policy. But trying to turn this into a party political football ill behoves the honourable gentleman, not least because his colleague, the member for Norwich, said yesterday, "What is Labour's policy on face masks? On that specific detail, I don't know. I'd like to know, as if we're going to call for clarity, it would be good to have clarity on our own policy." So I think we can take the criticisms from the front bench opposite with a pinch of salt. On the specific substantive questions that he asked, on Leicester, I set out that there is a process for whether changes can be made in Leicester. And the process is that we will look at 14 days of data. It is today 14 days since the measures were introduced. And we'll look at that on Thursday of this week and make a public announcement as soon as is reasonably possible about whether and if any changes can be made to the situation in Leicester. Thankfully, the numbers have been coming down in Leicester, and we've put in that extra testing. But the number of positive cases in Leicester is still well above the rest of the country, and I won't prejudge the decision that we'll take on Thursday, and we'll take into account all of the data. He asked for specific metrics. We won't set out specific thresholds. Instead, we'll look at all of the data, both the level and the rate of change, and make the appropriate decision in consultation with the local authorities. He asked about health and safety inspections. Absolutely, there are risk-based health and safety inspections on all of the types of facility that he mentioned, and absolutely this needs to be based on risk. For instance, we've seen across the world meatpacking factories have a much higher risk of having an outbreak, and so we have targeted inspections on those. He asked about data. Patient identifiable data is available to local authorities when they sign a data protection agreement. Of course there has to be a data protection agreement, and as he knows, we plan to publish more and more of this data as open data. So we will continue, Mr. Deputy Speaker, the work to control the virus. We'll continue to bring in measures as they are appropriate, and I look forward to a return to the spirit of constructive engagement for which the honourable gentleman is so well known.
Jeremy Hunt.
Thank you, Mr. Deputy Speaker. Can I congratulate the Health Secretary for the impressive resilience he has shown throughout the coronavirus crisis. But as we both know, the joy of his job is that winter is always around the corner. And one of the most sobering statistics in this morning's report from the Academy of Medical Sciences is that the number of people every day over winter who have COVID symptoms will increase from 100,000 to 360,000. And it is obviously vital to know which one of them have coronavirus and which of them just have regular winter flu. And they say it's essential to have a massive ramp up of testing and tracing capability before then. So could I ask him what his plans are to do that, and when he does that, will he be able to do what not just Sir John Bell, but Sir Paul Nurse and many other distinguished scientists are calling for, which is routine testing for NHS frontline staff.
Thank you very much, Mr. Deputy Speaker. Well, I take very seriously the Royal College report. We are engaged in a massive ramp-up of testing and of the contact tracing that my right honourable friend has long championed. The scale of the ramp-up of testing will be big enough to cope with the sorts of figures that are described in the Royal College report. That's even on the current testing technology. If there's a breakthrough so that we can get testing technology that's even easier to roll out, where it can be done at the bedside, next to the in the community, rather than having to be sent to a lab, then we will be able to have an even bigger rollout. On the final point that he makes, as he and I have discussed in this chamber before, we've put in place a programme of regular testing of NHS staff that is advised by the clinicians, that insists on regular testing that is, again, risk-based. And as we further ramp up testing above and beyond the current 300,000 a day capacity that we've now achieved, which is one of the highest in the whole world, we will, of course, continue to expand that effort.
Video link, Martin Day.
Thank you, Mr. Deputy Speaker. I thank the Secretary of State for his statement. It represents a welcome step towards preparing against any potential new second wave of coronavirus infections this winter. The virus have not been eliminated. So as we lift lockdown and people increasingly interact with one another, we need to use every tool we have to reduce the risk of a second wave. A report commissioned by the UK Chief Scientific Advisor, Sir Patrick Vallance, has concluded that July and August must be a period of intense preparation for a potential winter resurgence of the virus, with R potentially rising to 1.7 by September. The report's worst-case scenario forewarns of an estimated 119,000 associated hospital deaths between September and June, more than double the deaths we saw during the spring wave. This outcome, of course, does not take any account of likely actions which the government may take, and I sincerely hope that an elimination strategy is adopted as part of this. However, the move to compulsory face coverings is therefore a welcome and helpful intervention. I am in no doubt, however, that effective uptake will require consistent and effective public messaging. So far, we've had the Chancellor Duchess of Lancashire say on Sunday that face coverings should not be mandatory. The Justice Secretary is saying, I think, mandatory perhaps. The Prime Minister is saying he's looking at the evidence. And thankfully, the Health Secretary today says it will be mandatory. Perhaps he can confirm the implementation date. Press speculation has suggested the 24th of July. When the head of the World Health Organization said yesterday that mixed messaging from leaders is one of the worst challenges in tackling COVID-19, who do we think he had in mind? The chair of the British Medical Association has said each day that goes by adds to the risk of the spread and endangers lives. So while I welcome the UK government falling into line with Scotland and 120 other countries worldwide on this measure, it needs to be a component of a wider elimination strategy, not just keeping the virus down. So I hope the Secretary of State will take this opportunity to commit to an elimination strategy today.
Thank you very much, Mr. Deputy Speaker. Well, I certainly agree with the honourable member that the UK has, throughout this virus, largely moved in lockstep, in some cases, but for a few days in terms of the implementation timings of these sorts of decisions. And that's a good thing, because we're far stronger when we work together as one single United Kingdom. And I welcome the Scottish Government's support for the decision that we have taken. I would, the only thing that I'd add is that absolutely suppressing the virus is critical, as all countries around the world have discovered. Elimination is extremely difficult, including those countries where they thought that elimination was achievable, are finding that then the cases pop up again. And therefore, the correct approach, which we're following right across the United Kingdom, is to ensure that we have local action whenever we see cases to clamp down on them as much as possible in order to suppress the virus while being able to lift those national measures.
Richard Holden.
Thank you, Mr Deputy Speaker. I'd just like to praise the Secretary of State. It's great to see that this is the third week of lower than average deaths across the country, so it shows that we're really getting a grip on the virus, and we've seen some real reductions in rates in the northeast as well. But as the economy opens back up, confidence is absolutely key for my local community and the local economy, particularly for those coming back from shielding in August. But also the confidence that when there are local outbreaks, like there has been in my constituency in the last 48 hours, that the track and trace is there for people. Could my right honourable friend tell the House how many people have already been tracked and traced across the country to help give people confidence that the system is working?
Thank you very much, Mr Deputy Speaker. There's 144,000 people who have been asked to isolate who simply wouldn't have known that they had been at risk before the large-scale track and trace programme was put in place. And it's vital that we've got the resources there to act, and that we have plenty of resources in test and trace. For a while we had criticism that we had too many people and we didn't have enough for them to do. But as the Royal College's report shows this morning, as the Chair of the Health Select Committee said in his remarks, and as my honourable friend has just alluded to, it's vital that we have that capacity so that whenever we need to trace an outbreak of the virus, we can get right in there and take the action we need to.
Beth Winter.
Thank you, Mr Deputy Speaker. Every COVID-19 death is a tragedy, a family changed forever. And the tragic but inescapable truth is that the UK government's response to this pandemic has resulted in one of the worst death tolls in the world. However, adjusted for age, the death toll in England has been 81.9 people per 100,000 of the population, compared with 67.6 in Wales. Commons Library research indicates that excess deaths across the pandemic period have been 15% higher in England than in Wales. And this is despite the fact that a significantly greater proportion of the Welsh population live with long-term limiting illness. What does the Secretary of State believe explains this disparity, and what lessons can his department learn from the Welsh Government's response in preparation for further local outbreaks and a potential second wave?
Thank you very much, Mr Deputy Speaker. Well, I've been engaged positively with the Welsh Government throughout this, and where we have concerns, for instance, the outbreak that the Welsh Government was handling in Wrexham or on Anglesey, we have been in communication about it, and especially where there's an issue on the border. I'd caution us slightly against the sorts of comparisons that she makes, but what I would say is that this exercise is best conducted together, and that's why we take the approach that we're tackling this virus across the whole United Kingdom together.
Virtual link, Peter Bone.
Thank you, Mr Deputy Speaker. Secretary of State, could you say why the new policy on face coverings was announced to the media last night rather than to Parliament first?
Mr Deputy Speaker, I've come to Parliament to explain it at the first opportunity.
Liz Saville-Roberts.
The Academy of Medical Sciences is very clear. Prepare now for a winter COVID-19 peak. Now, surely we must grasp this chance to learn from past mistakes, such as PPE shortages and a Welsh Government gazumped by the British Government on testing equipment. Will he commit to a rapid review, not to point the finger of blame, but to stand ready to implement what we've learned before winter is upon us?
Mr Deputy Speaker, this attempt to divide us is very unfortunate. The UK government has put testing capacity into Wales that is bigger than the NHS Wales's own capacity, and we do that in Scotland as well with the same effect. We're working together in partnership across the United Kingdom, and absolutely we're making the preparations now for winter, as she and every other member of this House would expect us to.
Angela Eagle.
Thank you, Mr Deputy Speaker. Secretary of State, if test and trace is going to work effectively and people are going to take the advice that they're given via that service, some of them will find it difficult because they're earning no money and there's a choice between self-isolating and being able to pay the bills. So will the Secretary of State look once more about the issue of sick pay for those, especially in local lockdowns, who are asked to self-isolate on behalf of all of us?
Yes, Mr. Deputy Speaker. Of course we keep this under review. The evidence shows that the most important difference that we can make to get yet more people into the test and trace system is for everybody who has any symptoms at all, if in doubt, get a test. That is where the biggest gap is. That's partly due to the number of cases where people have no symptoms, where of course they themselves wouldn't know that they need to get a test, and finding them is incredibly important and done through contact tracing. But also making sure that people, if anybody has coronavirus symptoms and therefore needs a test, should come forward and get a test. And if in doubt, get a test. And there is, of course, an important consideration to make sure that people are supported if they need to isolate. And we're working closely with business to ensure that that happens.
Simon Fell.
Thank you, Mr. Deputy Speaker. The experience of this virus in Barrow-in-Furness is that it's hit most those who've got underlying health conditions or who live in areas of deprivation. Surely a lasting legacy from coronavirus should be a move towards early intervention, so we can lift people out of health inequalities and deal with issues before they become intractable problems. I wonder if my right honourable friend might be able to share his views on this approach.
Yes, I strongly agree with this point of view that's been so eloquently expressed by my honourable friend. It is critical that, as well as tackling coronavirus and the economic consequences of the action that we've had to take, that we also tackle the deep-rooted health inequalities which have exacerbated this disease and its impact on many people. This is a critical part of the levelling up agenda. Issues like obesity in particular clearly have an impact on how badly people are affected by coronavirus, and we need to take action in order to make sure that people get more equal life chances across this country.
Yvette Cooper.
Thank you, Mr. Deputy Speaker. Transparency and trust are crucial to any public health crisis, but public health directors still need household data on infections, not just postcode data. And Wakefield District have told me this afternoon they're still not getting the household data on the positive tests, even though we've had outbreaks at Forza Meat Processing Factory and also at Urban House Asylum Accommodation. And the public also need proper weekly cases information, not just at local authority level, which in itself is hard to get hold of, but also at town level, at constituency level. Will he not now publish for everybody across the country that more local, constituency or town level data on the weekly cases each week?
Mr. Deputy Speaker, the information that she has requested is available to Directors of Public Health in upper tier local authorities, and we're extending that further. And in addition to that, I want to see much more data published as open data, and I've requested that happens, and I'm sure that it will happen soon. But the truth is that following requests from Directors of Public Health right across the country, we have extended a huge amount of data to them. And those that have signed data protection agreements in upper tier local authorities who have the statutory responsibilities for dealing with this have got the data down to the personal details that she requests.
Robert Goodwell.
Thank you. On a conference call with the North Yorkshire Resilience Forum yesterday, I discovered that whilst the Borough of Scarborough had experienced 561 cases in total, apart from one isolated case on the 3rd of July, we'd not had an infection since June the 23rd. So would the Secretary of State join me in paying tribute to the people of Scarborough and Whitby for so assiduously not only following the government guidelines, but applying liberal quantities of Yorkshire common sense?
Absolutely. The people of Scarborough have been well represented and well led by my right honourable friend, and they are doing a great job in following the social distancing rules, making sure that they take appropriate precautions, and as a result the disease has been really suppressed in Scarborough, so I'm sure that the people of Scarborough will be able to enjoy summer safely.
Video link, Dr. Lisa Cameron. Lisa, we can't hear you. Can you try one more time, Lisa? We're going to come back to you at the end, Lisa, and we'll try and sort out the technical problem. James Sunderland.
Mr. Deputy Speaker, could the Secretary of State please outline what is being done to enhance procurement resilience within the NHS, and also what is being done to ensure that British companies get orders of PPE, not just China?
Yes, Mr. Deputy Speaker, I'm absolutely determined to see this happen. Many British companies have stepped up to the plate to deliver PPE, and a very significant proportion of our PPE will be manufactured in the UK by the end of the year. It's a very important part of our global resilience.
Catherine West.
Thank you, Mr. Deputy Speaker. The much-loved author of Don't Put the Mustard in the Custard, Mr. Michael Rosen, has broadcast very eloquently on the BBC his experience of excellent healthcare in the local Whittington Hospital. However, what he has also expressed very eloquently on Twitter is the sequelae or after effects of COVID. What urgent steps is the Minister taking to address in the community tailor-made experience, proper healthcare for those who are still suffering months after they've had COVID?
Mr. Deputy Speaker, the Honourable Lady raises an incredibly important question for the small but significant proportion of people who have long-term detrimental effects from coronavirus. I think that I'm glad that Michael Rosen got such excellent care at the Whittington, and I can assure him and her that we are putting in place, firstly, the NHS treatment available to people with long-term impacts, and secondly, putting in place the research to make sure we understand as much as possible about this, because it is still little understood.
We're going to give one more try. Video link. Dr. Lisa Cameron.
Thank you, Mr. Deputy Speaker. As chair of the Disability All-Party Parliamentary Group, I've been hearing concerns from those who may be exempt from wearing face masks, but are fearful of being confronted because not all disabilities are visible. So would the Secretary of State join with me in congratulating East Kilbride's Hannah Kelsall for developing free Chase the Rainbow carry cards explaining this exemption? Ultimately, no one should ever be challenging vulnerable people outside. It takes a lot of courage for many to leave their homes. But these innovative cards are providing reassurance for many across my constituency and beyond.
Mr. Deputy Speaker, it is very important that as a society we look out for the most vulnerable, especially through this epidemic. And the initiative that the Honourable Lady describes is just one way in which all of us can support people who have particular circumstances. And it relates directly to the introduction of the mandatory use of face coverings in shops, because there are important exemptions, and it's important that people are able to express the reasons, express that they have an exemption, so that they can still shop because of their medical condition requiring them not to wear a mask.
Marco Longhi.
Thank you, Mr. Deputy Speaker. Will my right honourable friend please provide the House with an update on the NHS's Open campaign to make sure that members of the public in Dudley, in Gornal, in Upper Gornal and Woodsetton, and indeed in Sedgley, and beyond, of course, that if they need to seek medical help, they can do so?
Yes, Mr. Deputy Speaker. I want to reassure people in Dudley and beyond that the NHS is open. If people need NHS treatment, then they should go to the NHS. In the first instance, go to their GP by phone or by telemedicine, or call 111 or go to NHS 111 online. And if people are asked to go to hospital or into a surgery, then they absolutely should, and it is safe for them to do so.
Mary Kelly Foy.
Thank you, Mr. Deputy Speaker. The only way directors of public health can properly tackle COVID-19 is through an integrated approach to testing, tracing and outbreak management. Currently, the system of the government is treating each of those separately, with little regard to how they are interconnected. Does the Secretary of State accept the limitations of this system, and will he reallocate resources so that regions can develop integrated approaches for coronavirus test, trace and management?
Mr. Deputy Speaker, all of those things are absolutely vital to be brought together, both at a national and at a local level. They are, and I think that the actions that have been taken under the NHS Test and Trace programme, whether that's national actions or local actions and the interaction of the two, the work that's gone on so far is testament to the fact that we are increasingly integrating the national and local work, and we're increasingly ensuring that the best high quality data available is shared.
Scott Mahan.
Thank you, Mr. Deputy Speaker. In the unlikely event that it get a local outbreak in or town or village in Cornwall in the summer, could the Secretary of State outline what a local lockdown might look like for local people and anyone holidaying in Cornwall over the summer?
Yes, Mr. Deputy Speaker. A local action can be anything from action in an individual business premise, an individual farm, as we saw in Herefordshire over the weekend, an individual GP surgery, up to a group of organisations, or indeed, if necessary, a whole city. And the approach that we take is that for an individual premise, that is largely a decision for the local director of public health to take. But of course, once you get up to the level of a whole city, that has to be a decision that's taken nationally by government. And we'll be publishing more details of this escalation procedure in due course.
Munira Wilson.
Thank you, Mr. Deputy Speaker. The Academy of Medical Science report today states that July and August are critical months for, quotes, intense preparations for a possible second surge. So specifically, what measures is he taking to stress test the PPE supply chain during that period, as the report recommends, given that recent improvements to supply have not taken place in worst case scenario conditions? And furthermore, will he be responding to calls from Care England and the Relatives and Residents Association to provide PPE to adult social care free of charge as an important public health intervention ahead of a second wave?
Thank you very much. Of course, we're doing that work to stress test the delivery of PPE and also to rebuild the stockpile. We had a huge stockpile at the start of this, but the distribution of that stockpile was extremely difficult for a couple of weeks, whilst we fully sorted it out and got the supplies flowing back in from abroad and built up the domestic supplies. Lord Paul Dayton has done a remarkable job in putting together the logistical effort. And it's absolutely true, exactly as she says, that over the summer we're doing the work to ensure that we're ready for winter.
Russell.
Thank you, Mr. Deputy Speaker. I welcome the government's announcement that immigration health surcharge will be exempt for health and social care staff. And as set out by the Home Secretary just this week, we will launch a health and care visa, providing exemption to the health surcharge up front for either themselves or their dependents. There are, however, as I've looked into it, some in social care who will not be caught by this. And so could my right honourable friend please update the House on how he plans to ensure these social care workers will be exempt from paying the health surcharge?
Yes, Mr. Deputy Speaker, I can. I can announce today that all employees working in health and social care will be exempt from the immigration health surcharge, and that all employees in health and social care who've paid the immigration health surcharge on or after the 31st of March will be eligible for a reimbursement. We value enormously the work that people do right across the NHS and all across social care, and I'm glad that we've been able to make this announcement.
Shannon.
Mr. Speaker, can I first of all thank the Secretary of State for his update. Media has highlighted the role of carers and those that they look after, and the queries in my constituency office would reflect that. So will the Secretary of State outline if he has considered allocating additional funding to respite services for carers, bearing in mind that many have been caring for their loved ones without a break for 15 weeks intensively, and many of them are on the brink, and I believe, very sincerely, need a time to rest.
Yes, Mr. Deputy Speaker, this is a really important subject, and I'm very happy to talk to my honourable friend about it to make sure that we get the best possible support in. It's obviously very difficult, and I pay tribute to all those who've been caring for loved ones in difficult circumstances. We often, when we clap for our carers, we clap too for those unpaid carers who give so much.
Christian Wakeford.
Thank you, Mr. Deputy Speaker. I thank the Secretary of State for his statement. Will my right honourable friend join me in reiterating that while cloth face coverings can help reduce the transmission in some circumstances, face masks worn as part of PPE for healthcare and other workers should be reserved for those who need it? And can my right honourable friend also confirm that wearing a face covering is not a substitute for social distancing, and we should do both?
This point is incredibly important, that a face mask can reduce the risk of transmission, and in particular it protects others should you be positive and transmitting the virus, especially when you're asymptomatic and don't know about that. But it can only be effective as part of a broad measure of social distancing measures, and is not a substitute for social distancing and for washing your hands. And it's easy to forget that washing your hands is one of the most effective protections against the transmission of this disease, and indeed keeping surfaces clean.
Thank you very much, Mr. Deputy Speaker. Nightingales sat empty whilst his government's guidance allowed people to die needlessly in care homes. With 120,000 extra deaths predicted this winter, when will he be making changes to this guidance?
Mr. Deputy Speaker, the Nightingales project was one of the most successful projects in the history of the NHS. Building the Nightingales in 9 days is something that many people thought in this country would be impossible. But the Nightingales were designed very specifically for intubated patients who were not conscious, and they were not built to be effective and usable for people who are, and there's some very practical reasons for that. So I understand the honourable lady's call to use Nightingales for other reasons, but they were built with a specific intention in mind. They met that intention, and they were a great success.
Thank you, Mr. Deputy Speaker. The pandemic has inevitably led to a backlog in other treatments, and that's obviously causing anxiety amongst my constituents. Can my right honourable friend give an assurance that the Northern Lincolnshire and Goole Hospital Trust and the 2 CCGs that serve my constituency will have the additional resources they need to meet the backlog?
It's absolutely vital that we deal with this backlog of cases that is building up because of the absolutely necessary requirement in the peak of the crisis to pause a lot of that activity. And I can absolutely assure him that we'll continue to support and protect the NHS, including with increased resources. It brings me back, Mr. Deputy Speaker, to something that the honourable gentleman opposite said at the start that I should have responded to, which is that he seemed to complain about the £1.5 billion of capital funding that we've put into the NHS recently. But of course it's very important also that we take forward the measures to ensure that there's capacity there too.
Chris Elmore.
Thank you, Mr. Deputy Speaker. Of course, the whole House hopes that in the coming months a vaccine will be developed that can be possibly rolled out early in the new year. But in the meantime, I know this issue is close to the Secretary of State's heart, 58 million people, up 7.7 million since the outbreak across the UK and the US, have joined anti-vax Facebook pages. Tech companies, mainly Facebook, have made more than $1 billion supporting and advertising anti-vax sites, including selling fake cures and discouraging the public from gaining any medical support when showing signs of COVID. As we move towards finding a vaccine, can I press the Secretary of State now to look at putting in more investment into ensuring that we tackle these anti-vax sites? Because as it's been described by many, it simply is an ideological dirt bomb waiting to go off.
He's absolutely right, and he and I are passionately of one voice in this, as I think is the whole House, that the government will only recommend a vaccine when it is known to be safe and effective. And we then need to administer that vaccine, and people can have confidence in having it. And people who propagate untrue myths about vaccines are putting lives at risk. This is true with the measles jab, it's true with other jabs too, but it is true in this case. The social media companies have an important responsibility. They have taken some action already, and I pay tribute to them for that. In fact, I have a meeting later this week with a Mr. Nick Clegg, who is in a position of responsibility with Facebook, but it's not only Facebook and Instagram who have taken action, but we'll be discussing what more action can be taken to make sure that people who are propagating lies about vaccines do not manage to spread those lies.
Andrea Leadsom.
Thank you, Mr. Deputy Speaker. Nobody has worked harder than my right honourable friend to try and save lives and protect people throughout this pandemic. But I know that he, like me, would like to see a safe and fast economic recovery. So can he clarify something, please, for my constituents? I have wedding events organisers and business meetings organisers who are genuinely asking, what's the difference between a restaurant that can safely social distance with perhaps 60 covers and a wedding that's only allowed 30 people who are also social distancing with all of the motivation to do so? Is there some health reason for that, or is that simply a straightforward matter of trying to reduce the return to economic activity?
No, this is essentially a judgment about ensuring that people have the appropriate social distancing with, of course, the maximum return to economic and social life as is possible. There's a judgment as to where these sorts of restrictions are put. They're the sorts of restrictions nobody would ever want to put in place. But it is true that the problem here is that the virus thrives on social contact, and exactly the sort of social contact that people want to undertake when they're celebrating something like a wedding. And you can't negotiate with this virus. All we can do is try to have the right balance of measures to keep the spread of the virus down, whilst also allowing the restoration of economic and social life. And ultimately, the rules that we've put in place around this are judgments. They're the best judgments we can make with the information available. We constantly keep them under review, as I hope my right honourable friend has seen, for instance, with the reopening of nail bars and beauty salons this week, and we'll keep them under review as we keep the data on the spread of the virus under review.
Alan Bryan.
Thank you, Mr. Deputy Speaker. In your statement, the Secretary gave a statistic that says retail workers have got a far higher than average chance of being affected by COVID-19. So if that's the case and mandatory face masks are about saving lives, why is it taking so long to take action to make it mandatory, and why is the reported implementation date July the 24th?
Well, the implementation of this will be on the July the 24th to ensure that that shops and businesses have time to put this into place and to make sure that the implementation can be done in an orderly way.
Desmond Swain.
Nothing would make me less likely to go shopping than the thought of having to mask up. Was this consultation with the police force, and particularly the Chief Constable of Hampshire? For it is she that will have to enforce this monstrous imposition against myself and a number of outraged and reluctant constituents.
Mr. Deputy Speaker, the balance in the need to restrict the spread of the virus, whilst also allowing the ancient liberties of a gentleman to go shopping, is a difficult balance to strike. And we have made the judgment that the best way to strike it is to allow a gentleman to go shopping, but require him to wear a face mask. And of course, the enforcement is for the police, but the enforcement is, I think, will largely be undertaken by the British people themselves, who have been remarkable in their fortitude at sticking with these rules, even whilst they may be a frustrating imposition.
Video link. Margaret Greenwood.
Thank you, Mr. Deputy Speaker. Wirral Council has led the way in recognising the importance of the work that care workers do by making funding available for providers to pay them the real living wage for this financial year. However, the scheme is not mandatory and not all care homes currently pay it. The government has taken £7.7 billion out of adult social care budgets since 2010, and the care sector is facing real challenges. When will the government step up and fund social care properly to ensure that all care workers earn at least the real living wage?
Deputy Speaker, I'm incredibly proud to have supported the introduction of the living wage. We brought that in and it has had a bigger impact on care workers' salaries than on the pay of almost any other sector. And the introduction of the living wage is a real testament to the fact that this government supports the lowest paid workers to get the support they need. And that is true in social care across the board. And she says it's not mandatory. It absolutely is mandatory and it is enforced, and we're putting the living wage up.
Ben Spencer.
Thank you, Mr. Deputy Speaker, and I, like many colleagues across the House, pay tribute to my right honourable friend and his team for driving down infections across the country. One of the lessons we've learned through this pandemic is that while it's easy to impose restrictions, it's a lot more difficult to lift them. Could he therefore explain the criteria that will be used for lifting mandatory face masks while people go shopping?
Well, Mr. Deputy Speaker, in the same way that these are judgments on the way in, they're judgments on the way out. And we'll have to make that judgment according to the spread of the virus, and in particular the risk level imposed by people catching the virus. And we'll keep all of these things under review.
Video link. Rosie Cooper.
Thank you, Mr. Deputy Speaker. The data currently has an inbuilt delay, and the ability to do test, track and trace effectively needs the shortest time between testing and local action for the greatest success. Simply, the more local control, the quicker things will happen. Because there are more handovers, the more time it takes, the less successful it is. So I'd like to ask the Secretary of State why he doesn't trust local systems, including the NHS. There are those who think that this is an attempt to discredit NHS labs.
On the contrary, NHS labs have done an incredibly important job. We've expanded the NHS labs enormously, and we've brought in the drive-through centres. This is a massive team effort, and trust amongst the team is an incredibly important part of getting this right. And she's absolutely right about concatenating the time taken from the suspicion of somebody having COVID through to not just getting the test and getting the test result. All those times are coming down, but also then taking action based on the result, whether that's isolating the contacts of that individual, or indeed taking wider action if it's part of a cluster or indicates that there might have been an outbreak. So I entirely agree with that part of the premise of her question. It's very, very important, a huge piece of the work of the NHS test and trace at the moment. And as per the second part of the question, all I'd say is we're doing everything we can to bring the system together with the support of all those involved.
Michael Wood.
Thank you, Mr. Deputy Speaker. Most COVID deaths in hospital are now understood to be due to sepsis as a complication. In light of the former CMO's concerns around increased antibiotic use during the pandemic, can my right honourable friend reassure me, firstly, that the data on COVID-19 are granular enough to identify the mode of death of patients in hospitals, and secondly, that the government will support the NHS, if challenged, when making prescribing decisions in these unimaginably difficult times?
Well, yes, it's a very important medical question that my honourable friend asked, and we know that he has deep personal interest in sepsis. And all I can say really is that we're constantly learning all the time. I won't try to answer the clinical parts of his question because I'll leave that to more qualified clinical and medical colleagues, but it is an incredibly important question, and my view is that as much data as possible should be available for research, and I've put in place regulations and indeed a direction necessary to allow for the research to be done in a much more effective way than was available in the past.
Video link, Bill Esterson.
Italian doctors are once again warning us, this time of the threat from coronavirus of a series of life-limiting illnesses which can affect anyone who has had even the mildest of infections, including the Secretary of State and other members of this House. Sometimes the illness only returns many months later. The advice from Italy is everyone who catches the virus faces a long-term threat to their health. Can we listen to their advice this time? This is about so much more than masks in shops and a completely inadequate test and trace system.
Mr. Deputy Speaker, it's a shame because the honourable gentleman makes a really important point and masks it in unfortunately adversarial language, because the test and trace system is getting better and better. Masks in shops are important, but the underlying point that he makes is absolutely right, that the long-term impacts of this on some people can be very significant, and there's growing evidence of that. I've put in almost £10 million worth of research funding to try to understand that better. The NHS has built an NHS service for people in those circumstances. He's quite right that the long-term impacts can affect anyone, no matter how mild the initial illness. Thankfully, I don't appear to have any long-term effects that I can tell or that I know about, and I'm fine, but I'm grateful to his interests. What I would like to do is work alongside him to try to understand this as well as possible, and we absolutely are listening to the evidence from right around the world on this vital question.
Lee Anderson.
Thank you, Mr. Deputy Speaker. In a short space of time, Kingsmill Hospital in Ashfield has gone from inadequate to an outstanding rating from the CQC. During this pandemic, the hospital has been fantastic in providing brilliant care in Ashfield and in supplying PPE to care homes, funeral directors, chemists and anyone that needed them. Would my right honourable friend please say a big thank you to all staff, including the Chief Executive, Richard Mitchell, hospital cleaner, Paula Wetton, porters, Michael Thorpe and Colin Ford, Scott Cairns in mattress decontamination, as well as critical care nurse Tracy Haig, who represent the very best of Ashfield, and would he please come and visit the hospital the next time he's in Nottinghamshire?
Mr. Deputy Speaker, I'd love to come and visit Ashfield Hospital in person and be able to thank every single person who is there and who's worked so hard during this pandemic, from the Chief Executive, the porter, the nurses who he mentioned, and all those who played their part as part of the team. One of the things that's happened in Ashfield is that the hospital does not regard itself as separate from the rest of the community. It is deeply embedded in the community. It works across primary care, the community trust, and with the mental health trust as well. It is part of a system, and that is the future of the NHS, people working together rather than the silos of the past.
Lavendu Mishra.
Thank you, Mr. Deputy Speaker. Unfortunately, my written parliamentary question dated 5th of June regarding PPE for urgent dental care centres in my constituency of Stockport and Greater Manchester remains unanswered, but I'm going to try my luck with another question if that's okay. It seems likely that we have to live with COVID-19 for a long time. Data from care homes shows us that the rate of infection is higher when staff do not receive occupational sick pay. When will the Minister ensure that social care staff receive a proper pay rise, at least foundation living wage, to reflect the unbelievable work they've done during the pandemic? And when will the government legislate for occupational sick pay for all social care workers?
Thank you very much. Mr. Deputy Speaker, can I, through you, just note to the House that we have been incredibly busy in the Department for Health and Social Care, and so I will get back to the written question as soon as we possibly can, but we've been both absolutely inundated with questions, but also it's been all hands to the pump to try to respond to the virus, so I hope people will understand why sometimes our responses have been a little bit slower than they would in normal times, and I'll get right across that. I take it very seriously, I think it's very important, but we do, if I may, mitigating circumstances, and we'll get back on top of it. On the substantive point that he raised, absolutely, the increases in the living wage are very important for social care staff. And as I said in response to the earlier question, I'm very proud that we introduced it.
Jack Brereton.
Thank you, Mr Deputy Speaker. I know my constituents in Stoke-on-Trent South will be keen to know what progress is being made with the vaccine trials. Is my right honourable friend able to provide any further update on the progress of vaccine and treatment testing ongoing in the UK?
Yes, the vaccine programme is getting all the possible support we can give it, including attention right across the top of government, being led by Kate Bingham, who is doing the job brilliantly as chair of the Vaccines Task Force. The best answer I can give my honourable friend is that no news is good news, because we're trying to prove a negative, which is prove that if you've had the virus, then you don't. If you have the vaccine, then you don't get the virus. And so the longer that we go on with the current, without hearing that there's a problem, the better. We're working to a reasonable best case scenario of getting the vaccine in some point this year, but I would stress that that is the best case scenario. The central scenario is somewhat later, and there is a chance that no vaccine will ever work. So we need to work for the best and give our vaccine programs the best possible support, but we should also be cautious about whether one will ever come off.
Video link. Tulip Siddiq.
Thank you. A former director of public health who lives in my constituency has been in touch with me to express serious concerns about the real possibility of a second wave of coronavirus and his fear that lessons have not been learned from the government's response to the pandemic. What plan does the Secretary of State have to get an independent body to conduct an accelerated review of the government's response to COVID-19 so far, so that we don't make the same mistakes again?
Looking, Mr Deputy Speaker, at all of the evidence, and we take very seriously all of the academic, professional and medical studies into the pandemic, the response to the pandemic, both here and around the world.
Dr. James Davis.
Thank you, Mr Deputy Speaker. Further to today's announcement regarding the mandatory wearing of face masks in shops, is it anticipated that similar may yet need to apply in pubs and bars?
Well, we don't anticipate that at this point. We, of course, keep all things under review, but in the first instance, the proposal, in the same way that we brought this in on public transport and in the NHS last month, is to bring this in shops.
Chris Bryant.
If I can be cheeky, Mr Deputy Speaker, I think I can help the member for New Forest West with his problem about wearing a mask. He's a knight of the realm, so he should just consider it a visor. But to the serious question that I want to ask, it's very clear from the way that COVID has rolled out nowadays that lots of people are going to have brain injury-like conditions. There's going to be a substantial need for long-term rehabilitation. And this mirrors the work that needs to be done for those who've had traumatic brain injuries and stroke. So can I urge, many of whom have not had the support this year for obvious reasons, but are desperate for it. I understand the Chancellor of the Duchy of Lancaster is setting up a cross-departmental ministerial group which will meet before the end of this month. Will the Secretary of State make sure that that rehab for people with brain injury, whether from COVID or from anything else, is in place?
We're working on exactly that. And this is part of a number of questions that rightly have been asked about the long-term impact of COVID and making sure we have the NHS treatment available for it.
Thank you, Mr Deputy Speaker. Asymptomatic workers in care homes are now tested every week. Asymptomatic workers in hospitals are not. Why not?
The programme that we have in hospitals is a risk-based one according to the risk of the individual. It is much harder to put that risk base in place in care homes, and both of these proposals, whilst seemingly different, are based on the same clinical advice.
I'd like to thank the Secretary of State for the statement today. Point of order, Munira Wilson.
order, Mr Deputy Speaker. As we're heading into another recess with the ongoing pandemic and a potential second wave, as we've heard today, on the way, does Mr Deputy Speaker have any suggestions or provisions for how honourable members can scrutinise effectively during that period what the department is doing, given the challenges we have, as the Secretary of State has already alluded to, in terms of responding in a timely fashion to correspondence?
I'm grateful to the honourable member for her point of order and for giving me notice of it. Whilst it's not for the Speaker or me to advise individual honourable members or select committees how they may wish to carry out their work during recess, we may be able to help by emphasising again what the Speaker has said about the importance of correspondence from honourable members receiving prompt replies. And I agree that this will be of particular importance during a recess where the country is still facing a major public health challenge. I hope that ministers will give careful consideration to how they can support all honourable members carrying out their duties during this recess by providing prompt and helpful replies to correspondence. Mr Bill Wiggin.
Mr Deputy Speaker, thank you for that answer. You will be aware that 72 people were tested positive in my constituency this weekend. I did apply for an urgent question. I put my name down to be on the call list today. But could I ask you to gently thank Mr Speaker for all he's done to make our hearings possible, but to make sure that constituency cases can be heard by the Minister, because I've got another, well, tens of thousands of migrant workers in my constituency who probably need to be tested as well.
Thank you for that point of order. The Secretary of State for Health is still sitting in his place, will have heard that point of order. Further to that point of order, Secretary of State.
Point of order, Mr Deputy Speaker. I'd be very happy to meet with my honourable friend, who's an assiduous representative for his constituency, and to make sure that his concerns are taken into account. He's quite right to raise them. I've been working on them all weekend, and it's very important. I can reassure him that, as far as we know, the outbreak has been confined to the farm in question, but we absolutely will be looking into it in great detail.
I'm just grateful that I could be so effective in creating this meeting so quickly. I mean, it's just a very important point of order, though, and I'm extremely grateful for it, and extremely grateful to the Secretary of State for his response. Jim Shannon.
Thank you, Mr. Speaker. Mr. Deputy Speaker, can I just ask for the record? I think it's important that we look towards the autumn and winter times, whenever flus across I'm one of those who gets the flu jab every year as a diabetic, but very aware of the demands that there may be upon the health service, and we're going into recess. Is it the intention of the Health Minister and his department to come to this House and make a statement in the preparation that will be in place, so when it comes to the autumn and the winter, that we're in a position to respond quickly and effectively?
I thank the honourable member for his point of order, and clearly that will be a matter for the Minister, but we've still got a few days before we go into that recess. But there again, I re-emphasise the response I gave on behalf of the Speaker and the other occupants of this chair to Munira Wilson at the very beginning. Chris Wilson.
Chris Bryant. Now you're being so effective, Mr Deputy Speaker. I just wonder, because I raised with you last week the issue about Westminster Hall and how important it would be for many of us to be able to raise constituency issues in Westminster Hall. I just wonder whether you got anywhere yet.
Not at this moment in time, but I'm really hopeful that as we go into the September part of the next part of after recess, that sufficient progress will have been made that we can then start to normalise the proceedings in this chamber. I fully appreciate that the way that we're currently operating isn't how we would all like it to be, but we have to do it at a progress that is safe for all members and staff here. But I do hope that we will make sufficient progress. Point of order.
Point of order. Thank you, Mr Deputy Speaker. I just wondered if you could advise me on, in ministerial correspondence, when the response repeatedly comes back from civil servants and not the minister themselves. This is a trend that I've noticed more often recently, and I find it uncourteous, if I've written to a minister, for the minister not to respond. And I'm worried about going into a recess and more civil servant responses that don't provide the political context that's often needed. Could you advise on how I could encourage ministers to respond directly?
Well, I've been a Member of Parliament for 28 years, and the vast majority of replies I've had have always been from Secretaries of State or Ministers as to who is the relevant Minister in responding. And I know that the Treasury bench will have heard the point of order that he's made, and I hope that that will be fed back into the system. The House is suspended for 3 minutes.